Thanks so much for joining me on the Slice of Healthcare podcast. How are you today?
Hi, great. Thank you so much for having me.
Absolutely. I'm excited for us to chat. You are our second overseas guest. We had someone from Allo Doctor, the founder and CEO of Allo Doctor, which is out of Jakarta, Indonesia, came on several months ago. But I'm excited for us to connect and to have you on. I think we should dive right into it. I'd love if you could tell the audience a little bit about you and your background, and then we'll talk about Med and Beyond.
Sure. Hi, my name is Dr. David Zlotnick. I'm born and raised in Montreal in Canada, and I did my specialties in both family medicine and emergency medicine. And I worked at one of the biggest emergency rooms in Canada called the Jewish General Hospital in Montreal. Went to McGill University, where I'm still currently a assistant professor of family medicine at McGill. And currently, I am the Chief Medical Officer here at Med and Beyond, which we'll get into. We're a telemedicine and telehealth startup, really focusing on providing care to the and underinsured. That's really our target population we're looking to help.
Yeah, we're really excited to hear more about Med and Beyond. Yeah, that's cool that you're still a professor at the university today.
Yeah, still affiliated with the university.
How has that been being like teaching remotely, or were you teaching remotely even before?
So no, I would actually go there, and I spent part of my year teaching a residence there. And unfortunately, with COVID, that's sort of been put on hold for the last 13, 14 months. But plan on going back as soon as things are able to.
Very cool. Well, I appreciate the intro. I'd love if you could give us the quick description of Med and Beyond, what you're trying to do, and I guess where you're currently live today in the United States.
Sure. So here at Med and Beyond, we really started Med and Beyond with the belief that medicine and healthcare is a fundamental human right, and everyone deserves to have the highest quality care. And unfortunately, in the United States, that isn't always the case, and that's really where we're coming from. And like I mentioned before, we're really looking to provide telehealth services for the underinsured and the uninsured, which is a huge population in the States. About 80 million people fall into that category. And so we decided to start our journey in the telehealth space, really looking at the more acute and primary care. So doing the sort of urgent care kind of medicine, and that's where we are at this point. We're currently live in 5 states. We're live in New York, New Jersey, Florida, Michigan, and North Carolina. And in the next few months, we'll be expanding to Texas, California, and Pennsylvania. So we're very excited about that. And we really see this urgent care, sort of primary urgent care, as a first stepping stone into our real vision and our real goal, which is to be really the world's first digital HMO. We really want to provide all the possible services we can in the digital space. And of course, we'll have partnerships in the real world as well, not just in the digital world, in order to make that happen. But we really see and put a big focus on the long-term relationship with the patient, as opposed to just sort of a one-time visit and help the patient with the issue they have now. We really want to build a relationship, a rapport, get to know our patients, and slowly add on more and more clinics into our HMO, so we can really give a full range of services.
Interesting. Yeah, that's a different approach than there's a lot of companies in this space, right? So you guys have taken a unique approach. I think you started out with some great states, right? Yeah. You have a good mixture of the ability to see a lot of patients in those different states, and obviously with the addition of Texas, California, and PA. I'm not in your strategy meeting, but those make a lot of sense, right? You list a lot of the states where you want to be live in for offering telehealth services. Can you talk us through how things work? So I've had the opportunity to check out the application. You really seem like you spent some good time on design, which is it shouldn't be a rarity in healthcare, but I feel like it is. Can you talk about when a patient signs up, what that process looks like?
Sure, absolutely. So of course the user experience is super important for us. And how it works is the patient downloads our application, our app on their phone. And their first stage is we collect obviously some demographic information, and then they interact with our bot. We have an AI chatbot and sort of like a symptoms, goes through a triage symptoms and ask them questions depending on what their initial complaint is. Those answers are recorded and then displayed to the doctor. We have our own EMR that we created, and the doctor is able to see the results of the EMR of the chatbot, the AI chatbot, and able to, so that's displayed to the doctor, and the doctor then uses that AI and interacts with the patient on a video call. And so, for us, it's very important that every visit is a video chat with the doctor at this point. I think that there's a lot for us. It's very important, and it's a very big part of medicine to be able to see someone and have a connection with them, and even to help diagnose someone. I think it's very important to have just a look at them. And so that's sort of one of our visions. And so every visit ends with a video chat and a treatment.
What I guess type of are you already going after today, those underserved and what'd you say, underinsured and
uninsured and underinsured populations?
Yeah,
we are. We do that in various ways, whether it's our marketing, which is obviously a big part of it all, as well as our price point. We've been able to bring down the price point to about half of what the competition is, or what the other players in the competitive space, and to really target that population in that way. So again, we're looking at it in the pricing model as well as in the messaging model when it's coming to talk to those populations.
Interesting. Yeah, I think obviously price, a nice design, and then helping out the people that need the service the most. I think those are kind of three interesting pillars to set the company up for success. Are you still actively seeing patients?
Yeah, I still actively see patients as well, in the real world, in the digital world as well. I think I've been doing telemedicine. I like to say I've been doing telemedicine for about 20 years. I mean, that's way before the telemedicine that we know it. As I mentioned, I did my training in Canada, and I would spend quite a bit of time working in the Arctic Circle with the Inuit populations up there. And at that time, when it was telemedicine, it was actually telephone medicine. You'd be in one village and they'd call you the nurse practitioner, where amazing, providers of care would be in a smaller village and would call. And we had to deal with all kinds of interesting and complicated medical issues just on a phone call. There was no video call. There was, none of that at that point. So that was really the early days of telemedicine. And so it's quite amazing to see where we are today, where we can have a video chat with the patient and really get to see them. And, there's so many different wearables and other kinds of technologies. We're able to monitor the patients even in a closer way. So it's been a pretty exciting time, having seen it from the early days of picking up a phone to today.
Yeah, every time I would, going back, I guess, let's say before the pandemic.
Sure.
It's not that telehealth wasn't moving forward; it was moving forward. But I think the pandemic really helped to propel it. Like now, every healthcare conversation I hear about what the future of healthcare looks like, I hear it from a virtual first approach with everything, right? Or at the very least, a hybrid, which I think hybrid models will do really well. But you're not hearing about just traditional, like, we need to put together like this brick and mortar facility 100%. And this is where patients are going to go for everything. Like, I think those days are gone. I think we're going to be hybrid or totally virtual. We're not, as virtual as we can be for certain visits, right? Like primary care, a lot of those visits can be virtual unless there's a serious issue. Someone needs to go in and get something checked out or take a scan, right?
Yeah, I think you're absolutely right. I mean, I think, one of the things that COVID did was really educate the population about telemedicine. I mean, it was there, but all of a sudden you had sort of like a decade jump in learning and like understanding and in acceptance. Sort of in the early days, telemedicine was always seen as, sort of a peripheral aspect of the medical industry and the medical care. And all of a sudden, COVID sort of forced that acceptance of it in a way that all of a sudden people realized, wow, I'm not going to go waste hours driving, parking, sitting to get a prescription refill when that's all they're really the doctor is doing, for example, in that thing, or other medical conditions that could be easily treated via video visit. And I just think that's not going to be acceptable to the population anymore after learning that, it's just not efficient. And, certainly I don't, there are many things that you still need to be examined for. And there are things in medicine that you still need to see a physician or a provider in real life. But there is a large percent of medicine that can be done, via the virtual, digital world. And, I think that we're just going to see that increase over the next few years.
Yeah, I mean, you'll have people that forgo a standard yearly checkup, right? That even just hopping on a call or video chat, right, with a provider once a year, just that's it. That's better than what they're currently at too, right? To get some level of like checking in, is everything feeling fine, right? And then be able to push them towards that in-person care for scans and whatever else they need, right?
Yeah, absolutely. I mean, you're looking at especially the population that we're targeting, where we've seen people, like you said, forgoing their annual checkups or forgoing basic care, or even getting to a point where they're in a critical illness because they haven't done they haven't seen a physician early enough. So if we're able to provide it in an efficient manner, in a digital way, as well as in an affordable way, targeting these populations that need it the most, then I think that we're able to really contribute something great to the system. That's really what our goal is.
What are some of the things that you're most excited about? We just started month 3 of the year. What are some of the things you're most excited about as we get into 2021 for the company?
I think that the expansion to other spaces besides the urgent and the primary urgent care that we do now, we're really expanding to different clinics, and we're looking at how we're in the process of opening family plans where you'll be able to have a whole family on the app. And we're looking into having, as well, we'll be starting sort of a dedicated family doctor. So not just as an urgent care, one of the sort of complaints or issues that patients often bring up about telemedicine is that they're, every time they have an issue, they see a different doctor. So we'll be able to provide a family physician, and that patients can see a dedicated family physician and make appointments with their own family doctor and be followed by someone they know. And that creates a whole different relationship and a whole different, feeling of being cared for when you have the same family physician caring for you time after time. So I'm really excited to be able to provide that service, especially to a population who normally didn't have access to that. So that's one of the many exciting clinics and other services we'll be providing on the platform in the coming year.
Yeah, I'm looking forward to, and a lot of these things that you're excited about. The goal for our audience is to have you and other members of your team on multiple times, so we can kind of focus in on different areas, but at the same point, not ask them to listen to a 40-minute podcast, right? So that's why we're separating it into different chunks. So I'm excited to speak with you again and some of the others on your team and kind of talk about some different parts of the business. So I really appreciate the intro. Where could people learn more about Med and Beyond?
So they can go to our website, www.medandbeyond.com, and we have a lot of information there. And any questions they have, we have a customer support team, and always happy to help and answer questions. If anyone has any issues or concerns or wants to know more about the service, we're available 24/7 to answer.
Perfect. Well, again, thank you so much for joining me on the podcast, and all the best of luck to you and your team, and look forward to having you and others on in the near future.
Thank you so much for having me. It was a pleasure. Thank you so much.